Our cardiovascular gross anatomy has some key components for us to know. The location of the heart's about 300 grams, it's size about the size of a closed fist, and it's located in the mediastinum. If we were going to have to call a rib out, we'd say between the second rib and the fifth intercostal space. And the apical impulse, where you can palpate the pulse of the heart, is between the fifth and sixth rib, typically about mid-clavicular line. The base is leaning towards our right shoulder, so right side for me here, and the apex is pointing towards the left hip. So it's kind of like at a tilt. And there's two surfaces we could speak to. The anterior surface is often called the sternocostal. Mainly, it's going to have our right atrium and some of our right ventricle. And then the diaphragmatic is mainly the left ventricle, and it rests on the central tendon of the diaphragm. If we wanted kind of two borders, the right border is vertical, and this is formed by the right atrium pretty much exclusively. The left border is round, and this is mainly the left ventricle and partly the left auricle. And then the inferior border is horizontal, and this is the right ventricle and the cardiac apex. Some key kind of components to keep in mind from an injury perspective at the mid left sternal border, the third to fourth intercostal space, the right ventricle is at risk. The left sternal border to mid clavicular space, around like the fifth intercostal space, medial, the left ventricle and left lung are at risk. And lateral to the mid-clavicular line, the left lung is primarily at risk. So kind of keeping us in line of like where things could be injured if there's like a stab wound or a puncture wound or something. And it's important to note that there's four chambers and four valves in the heart. This is showing kind of what our mid-sternal line would be considered, the sternum, the location of the apical impulse here, our diaphragm here, second rib, and then if we look, we can see the heart itself is kind of lying in this cavity from here to here, and so we can kind of see the ribs that are available, where our second rib all the way down to like our fifth rib, and so we have those intercostal spaces as well. You could associate those with vertebra, maybe around like T3 through T7 potentially, or even T8, but probably T7 would be appropriate. Again, looking at our heart, we can see kind of the anterior surface, the left pulmonary, the right pulmonary, the diaphragmatic surface, and we're looking at the heart here, and then the different structures, big structures of the heart. These are good like memory pictures just to help you kind of memorize and visualize the heart. But remember, on the NCLEX exam, you're going to have no images available. Our heart chambers, there's four, separated by septa. We have the right atrium, which is the receiving chamber. This is what receives blood from the superior and inferior vena cava, as well as the coronary sinus. It contains pectinate walls on the atrial, or pectinate muscles, I should say, on the atrial walls. We can see these pectinate muscles that kind of look like ridges on the atrium. There's also the fossa ovalis. This is a remnant of a fetal structure, the foramen ovale, which was a hole. We can see that here, that fossa ovalis. And it has a right auricle, which is an appendage that increases capacity. And I don't believe you can see that on this picture. You cannot. The right ventricle is the discharging chamber. It's what pumps blood into the lungs, into the pulmonary trunk. It's the largest portion, though, of the anterior heart surface of note. It has the conus arteriosus, or the infundibulum, that leads into the pulmonary valve. It contains trabeculae carneae and papillary muscles on the walls, and it has the septomarginal trabecula, which is this kind of moderator band that conducts blood across the cavity. So we can see chordae tendineae. We can see here this trabeculae carneae, these muscle structures. And then we can't really see like good examples of pectinate muscles here besides the trabeculae carneae or papillary muscles. Papillary muscles would be here, these papillary muscles. We'll see a better picture later. The left atrium is also a receiving chamber. It forms most of the base of the heart and it receives oxygenated blood from four pulmonary veins. The left auricle will overlap the pulmonary trunk. There are also pectinate muscles here in the auricle, but then the posterior wall is smooth. And then our left ventricle is a discharging chamber. It pumps blood into the aorta, has the thickest heart muscle or myocardium, It contains a bicuspid or a two-cusp valve, and it has the aortic valve with aortic sinuses. And between the atria and between the ventricles, there are septa or septum. And we can see this here between the ventricles better. This is the intraventricular septum. It's membranous in the upper portion and muscular in the lower portion. The interatrial septum contains the fossa ovalis. We can't see a great picture of that here. Again, another image to kind of help you be able to name or identify things. We see the fossa ovalis. We can see some of the tendinous cords and the papillary muscles here. Same idea. It's kind of giving you just those boundaries of the heart. I'm showing the fossa ovalis, the right atrium, showing the structures of the heart again with some of the muscles a little bit better drawn. We can really see the papillary muscles here labeled. And again, more memory tools. We have our papillary muscles. We have our septa really clearly laid out here. Atria are really not visible in this picture. So I mentioned some heart valves. Heart valves are separating our different chambers of the heart. And so there's some sequence mnemonics. Try pulling my aorta, right? Tricuspid pulmonary mitral aortic. Or like our AV valves mnemonic, lab rat, left atrium, bicuspid, right atrium, tricuspid. Or circuit order, try before you buy. Tricuspid first, then bicuspid. These are all different mnemonics that can help you remember the order of your heart valves. So if we go through it, we have our tricuspid, which is essentially the right atrioventricular valve. It separates the right atrium from the right ventricle. It has three cusps, and you would listen to it at the left sternal border, fifth intercostal space. Then we move to the pulmonary, which is a semilunar valve. This separates the right ventricle from the pulmonary trunk, or the right ventricle from the lungs. Also has three cusps, and you hear this in the left second intercostal space. The mitral or the bicuspid valve is in the left, or is the left atrioventricular valve. It's separating the left atrium from the left ventricle, and it's unique. It only has two cusps, and you hear this at the fifth intercostal space, midclavicular line. And then we end with our aortic, another semilunar valve, separating the left ventricle from the aorta or systemic circulation. Also has three valves in the right second intercostal space. This is where you kind of listen, aortic, pulmonic, tricuspid, mitral. You can see them from the top here. You can see that two-leaf mitral valve, two-leaf mitral valve. The atrioventricular valves have some unique components that help them use their function, the chordae tendineae and the papillary muscles. And we looked at some pictures of those. I think this has a really good image of the papillary muscles. This maybe gives you a better picture here of the chordae tendineae, these kind of tendinous components, and then the trabeculae carneae are over there. But if we look at what is the function of these different things, the chordae tendineae are tendinous cords, very much like their name, and they anchor the atrioventricular valve cusps to the papillary muscles. Their job is to prevent the cusps from backflowing, from everting back into the atria, and from moving blood in not a unidirectional direction. The papillary muscles are these projections from the ventricle walls that are contracting simultaneously when the vessel or the ventricle contracts, and they're pulling the chordae tendineae taut to prevent that backflow from happening. The fibrous rings of the cardiac skeleton are what's keeping these spaces open during times of rest or relaxation and when pressure isn't overloading the system. When the AV valves are open, that means that our atrial pressure is greater than our ventricular pressure. And that means this is a time for filling. This is a time for diastole, our filling time for our blood, for our heart. Blood starts to fill the atria. This pushes down on the AV valve. The flaps will open. The flaps will hang limply into the ventricles while filling occurs. Then the AV valves close when the ventricular pressure, the pressure in the ventricle, is greater than the pressure in the atrium. When our ventricles contract to move blood out of the heart, blood is forced backward against the cusps, and that forces the valves to close. Our papillary muscles then contract to tighten the chordae tendineae to prevent any regurgitation or essentially backflow of blood. Now, our semilunar valves, which is the pulmonary and aortic valves, do not have chordae tendineae, and they open with rising intraventricular pressure, and they just close when pressure falls, and then they backflow to fill the cusps to prevent them from, going back the opposite direction. Our heart sounds are related to these valves closing. Our S1 or our first heart sound, the lub, right, of our lub dub, is the AV valves closing versus S2, the dub of our lub dub, is the semilunar valves closing. This is showing these cusps, the tendinous cords, and the papillary muscles. You can see them really beautifully here. The chordae tendineae, the papillary muscle. And then this is just showing this would be like the aortic valve or the pulmonary valve, how they have these like cusps that just kind of hold space and they open with pressure. This is just showing a graphic of what we talked about with exactly the same kind of words. You could follow along here, showing blood flowing into the heart. Then when the blood is fully filled into the heart, ventricles contract, and that pressure is pushing on these cusps, forcing them to open, and then blood is going to eject out into the next space. We'll stop here. When we come back, we'll look at the conduction system of the heart.